Hi, how are you? We are students of the Technical University of Manabí and we study the third semester of the Parallel Medicine Career A. This is our English project on a clinical case about meningitis. My name is Juliana Pin and my partner Andrea Rezabala.
Objective: describe clinical case correctly. Introductions. Meningitis is an acute infection disease that it's not very contagious and affect people under 5 years old. Symptoms may include fever, headache, vomiting, and stiff neck. The transmission of this type of meningitis is mainly through the fecal oral. Case report: 7 years old girl with headache and fever of 5 days of evolution, also with photophobia, cervical pain, and vomiting from 1 day before. Personal history: complete immunization, exploration, weight 27 kilograms, normal hydrate, neurological, wake up, oriented, no alteration of cranial nerves, not visualization of hermano in gram staining, and mononuclear pleocytosis are the most significant element for the diagnostic of viral meningitis. Correct answer.
Evolution. She remains in an emergency observation room for 6 hours until the sedation ceases, initiating oral tolerance effectively. The polymerase chain reaction was negative for HPs and positive for enteroviruses. Given the clinical stability and the absence of neurological symptoms, she was discharged. Enteroviruses are RNA virus without envelopes. Transmission occurs by direct transfer from person to person of infected secretions or oropharynx or oral fecal transmission. Laboratory diagnosis. The polymerase chain reaction has allowed shortening the length of hospital stay and saving health costs. Enteroviral aseptic meningitis management using pleconazole, a drug that inhibits the production of virus during enterovirus replication with good oral availability. Final diagnosis: enterovirus meningitis. Conclusion: it was possible to describe the correct clinical case that resulted in enterovirus meningitis through the symptoms and manifestations that the patient present and their correct exams to verify the diagnosis. It has also helped us to know the different forms of manifestations the disease and to be able to keep an eye on if we present some of these in the future. Thanks.